Hello, I'm Nick Hewer, President of the Royal College of Speech and Language Therapists, and today we launch a project developed with charity and organisation partners, all of which share our vision and indeed mission, that of improving the lives of people with communication difficulties. We've called it Communication Access UK. The initiative provides training and resources to businesses and organisations across the UK to enable their staff to identify and understand communication difficulties and to improve their own communication, and in doing so, improve the lives of millions of people across the country who experience communication difficulties every single day. Those that register with the Communication Access UK plan and commit to implementing and adhering to its principles will become accredited as communication accessible and will be able to display the communication access symbol, a new disability access symbol akin to the wheelchair access symbol, to demonstrate their commitment to inclusivity. Now, joining me to launch this ambitious program are some of the UK's top business people, all leaders of business sectors which importantly interface with the public. Their support is vital in spreading the word and encouraging their disparate memberships to get involved for their own benefit and for the benefit of those with communication difficulties. And to host the discussion, I welcome the Royal College's Chief Executive and the driver behind this initiative, it's Kamini Gadhok. As our panel, we welcome Kate Nicholls, Chief Executive of UK Hospitality, representing the interests of some 800 companies across the country, from coffee bars, pubs, bars, restaurants, a powerful and effective voice for the hospitality sector. Now, joining Kate, we have Tamara Hill from the British Retail Consortium, the go-to trade organisation for all UK retail as a sector, which employs almost 3 million people. And representing the communications business, be it commercial or public sector PR, we're delighted to welcome Francis Ingham, Director General of the PRCA, the Public Relations Communications Association. We're also pleased to welcome Ian Wright, Chief Executive of the Food and Drink Federation, the voice of the UK's largest manufacturing sector, which employs over 400,000 people. And a warm welcome to Johnny Timpson of Scottish Widows, who is also Cabinet Office Champion for Insurance and Banking. And last, but certainly not least, we're delighted to be joined by Craig Goold of Skipton Building Society, who've been working with the Communication Access UK since its early days, and who we are proud to have as an early adopter. So I'd like to thank you all for taking the time out to join us as we launch Communication Access. And now let me hand over to the driver, the Chief Executive. Let me hand over to Kamini to lead the discussion. Kamini.
Thank you so much, Nick, for that wonderful introduction and for all your support so far. And big thanks to all of you who have joined the panel discussion today. We recognise that this is a really turbulent time for your industries, and the work that you all have is significant. So we do appreciate that you have taken the time out on something that we care very passionately about. And it's really important, I think, to reflect on how communication is something that we all take for granted. But I guess the pandemic has brought into sharp focus how barriers to communication can really affect us. And in particular, the barriers that have been created as a result of the need to wear masks. And having spoken to all of you prior to this discussion today, this is something that I know that you've identified as an area that you've had to grapple with. And trying to socialise for people day to day, that's created a problem for the general public, but also, I guess, for all of you in delivering a service to your customers. So today I'm really interested to hear from all of you what you've been doing and what your sector's been doing. So I'm going to turn to Kate first with respect to the hospitality sector. So Kate, what impact has the pandemic had? I think we're hearing about it a lot on the news already, but how are the adaptations affecting how businesses are being run? And have you found ways that your industry is responding?
Well, thank you. And I'm really pleased to be able to join you here today, because I think it's such an important issue that we address and get right. And in hospitality, we are the ultimate people business, and we thrive on face-to-face contact, communication, socialization, and all of the work that we've put in hospitality to address the equality agenda and access agenda has been focused on communication and one-on-one discussions. And so the impact of the pandemic has been really severe on our sector commercially, but it's also resulted in a fundamental change in the way in which we deal with our customers and the way in which we approach communication, which is probably what we're talking about today. It's put up so many barriers between people and between people in hospitality venues and the way that customer service is delivered. So hospitality has had the most severe restrictions placed upon its operations. We are the only sector of the economy now that has legal restrictions on our operations, and they hit both in terms of demand, but also in terms of supply, which is quite unique. So we've got restrictions on capacity, social distancing, occupancy, space, having space between people, which clearly makes communication more difficult. We have restrictions on the way in which we can take orders. We have restrictions on the number of people that can come to our premises at any one time. And we have restrictions on how we are able to seat and deal with them. So overall, our businesses are probably operating at sort of 60% of their previous revenues pre-COVID, but in city centre locations and those in tier 2 and tier 1, you are talking about 90 to 85 to 90% loss of revenue, and a loss of revenue that's been sustained throughout the year. So really, and hitting our staff and our teams, which is one of the most important points to make. In terms of what it's meant operationally and service-wise, we have had to move to a full table ordering and table service rather than going up to a bar and communicating in that way. It's all seated, it's largely reserved in advance online. And clearly now, as a legal obligation as well, both our staff members and our guests need to wear masks apart from when they are eating and drinking. So from a business that has gone from March being the place that you go, you socialize with your friends, colleagues, family, and you have a lot of interaction with the team member who's serving you, we've put so many barriers in the way of that communication. And we've worked hard to try and get our team members to focus much harder on what they need to do to get messages across to customers, rather than relying upon electronic information, because it's very easy to say you need a QR code to scan in, you need a QR code to do online ordering at the menu, which is what government policy is pushing us towards. For anybody who has any sort of disability or neurological difficulty or communications difficulty, moving online is not always the best answer, and clearly it gets in the way of what we're trying to do. So this is why it's such a good initiative today that you're launching, because it gives a very easy toolkit for our team members to sort of work harder and to think about how they are communicating with guests in what is going to be quite a challenging environment for at least the next 6 months.
Thanks so much, Kate, for highlighting some of those challenges, and also that I think, as you said, the training that we can provide will support your staff to look at how to remove some of those barriers to access.
Yes. I mean, we've all had a little bit of an experience of what it must be like to be deaf or hearing impaired, to struggle to be able to get ourselves understood. It's humiliating, it's frustrating when you're standing in a bank or a shop or a hospitality venue and you can't understand what the person is saying to you because you can't hear what they're saying through a mask, and you're having to repeat yourself 5 or 6 times. We've all had that experience. It gives us a small insight into what many millions of people will be living with on a daily basis. And hopefully as a result of that, we can get some good coming out of the crisis that helps us all to be a little bit more understanding about what people are dealing with and the challenges they're dealing with.
Thank you, Kate. So I wonder if I could turn to Ian then. I suppose building on what Kate said with respect to the fact that there's a level of getting an understanding of how this must feel like for people who live with communication impairment on an everyday basis, you know, in terms of having to work through communication through masks and trying to get your message across, but also hear what people are saying to you. Are there some simple things that you think that all businesses can do to help people?
Yes, I think, well, first of all, good morning and thank you for having me. Before I do anything else, I should just add to Nick's words about Kate Nicholls' astonishing impact on the way in which the government thinks about hospitality. She has been the real star of this pandemic, and I've been working very closely with her for several years now, not least because we share an office. An office space. So I just want to put that on record. It's the first chance I've had to do so. I think our challenge is a bit different from hospitality because our members are almost all factory based. So we're the largest manufacturing sector in the country, and that means that we have a very large number of factory type facilities. And by factories, I also mean places like bakeries and other food production facilities, which may involve thousands of people, or they may involve dozens or just a few. And all of those create different challenges for the businesses that we represent. And one of the interesting challenges is that they're already quite highly regulated environments because we're dealing with food and drink. And as a consequence, people are wearing, if not PPE, they are wearing workwear that is often very prescribed. So you have to wear, in certain circumstances, you already had to wear a visor. In other facilities, you already had to wear masks. You almost certainly are not allowed to attend in your ordinary day clothes. You have to change into workwear in a changing room, and then go through a proper sanitization process already. You did that before the arrival of the pandemic. Now, in some ways, that makes the adoption of masks or visors and so on much easier. But in other ways, it's actually a real challenge because there may be, indeed there are, facilities where wearing a mask would be dangerous because you're not able to communicate, you're not able to see what your colleague is doing. And of course, in many facilities, you may not ever be able to hear what's going on because you have to wear ear defenders because there's noisy equipment. And in a series of environments, they're all very different as well. And health and safety, both in terms of food safety and most importantly of the safety of the people working there, are major concerns. The other thing about our industry, as opposed to say the car industry or the aeronautics industry, is that our factories are widely dispersed. So there's a food manufacturing facility with at least 50 people working in it in every parliamentary constituency in the country. There's no area like Liverpool or Birmingham or Coventry or Dagenham, as there is, for example, in the automotive industry where there's a concentration. The other final thing I'd say about our industry, which is a bit different, is that we have multiple languages. So for example, in the Tate and Lyle factory in Newham, the famous sugar refinery on the river, 45 different languages are spoken. And that means that the challenges of communicating with people who have any kind of communication difficulty is a really big one. And I think industry, therefore, our industry has a preoccupation with safety, but in its preoccupation with safety, it has to begin to put considerations of people's ability to communicate and recognize the nature of communication front and center. And I'm not sure it's always done that. It's seen those issues through the prism of different languages or different cultures, but it hasn't always seen them through the prism of access for those with different disabilities to process the information. And I have a very personal view of this because about 4 or 5 years ago, my wife went deaf in one ear overnight. We still don't know quite why that was. And we had a comedy moment the next morning. She'd been quite poorly, but could hear perfectly well. The next morning in bed, the phone rang, she picked it up. She said, there's nobody on the other end. I could hear the person on the other end from the other side of the room. And that's had a massive impact on her life, and we've lived with it. But one very small vignette, which I know will be very familiar to those watching this, is that masks are massively difficult for her for two reasons. One is she didn't know that she lip read until about the middle of the summer, when it suddenly became clear that when people are wearing masks in all situations, that it's very difficult to understand what they were saying, because she couldn't hear them and she couldn't see them speaking. And the other thing is, and this is a really practical but difficult point, every time she takes the mask off, her hearing aids come out. And it's incredibly annoying. And I've talked to other people in the same situation who simply can't, there's no way that you can configure that arrangement around your ears and chin to make it work better. And that is both practical and could be extremely expensive. Some of these hearing aids are very, very expensive and very small and difficult to see. So I think business needs to think about these things from the point of view of the sufferer or the person who has the condition, whatever it is. And it may obviously not just be about hearing. And I think we need to be more employee centric in this going forward. And that's why I so welcome this initiative, because it makes us think about every individual in the workplace. And that must be a good thing, particularly in the spirit of the pandemic, where we're all trying to look out for each other.
So Tamara, you've just started touching on the fact that the retail trade has really tried to work hard right from the beginning. I think it sounds like you said before, as the pandemic first started, to think about how you could adapt to look at supporting access to your customers in terms of good communication. Did you want to just tell us a little bit more about that?
Well, yeah, I mean, retailers have traditionally been obviously very customer focused, and I do echo the points raised by Kate and Ian in terms of the challenges that this has brought with social distancing, the face coverings, etc. And as Nick mentioned in the intro, we've got 3 million employees within retail, but we've also got 100% of citizens in the UK that will have a sustained interaction with retail at some point, whether that's either physically by going into stores or visiting websites, purchasing online, and obviously receiving emails from those. So everybody needs to purchase food staples and be clothed. So I think it's very important that retail is on board with this, and I think they are well placed to kind of get these messages across. And as I said, they have traditionally been very customer focused. We are at the moment undergoing a huge piece of work on diversity and inclusion and making sure that they are inclusive employers and they have a diverse workforce. And we do have a lot regular roundtables looking at how they are able to support different characteristics under the D&I spectrum. So yeah, just I did send out this to a couple of our members, and they did, I guess they are able to kind of get the messages fed through quite well. They do sort of have communications champions in different stores. They will promote the initiatives. They will roll out the e-learning with their employer communications, and they will have, so that they teach sign language as well. So they will have like a champion in each store. So obviously this is some of the bigger ones where they will be able to speak different languages or have that sign language. So very much focused on their employees and their colleagues and making sure that they are diverse, but inclusive, but also for their customer base as well.
That's great to hear, Tamara. So as you know, we've developed the training to become an online e-learning module, and there are 3 different elements as well as the sort of initial introduction. It will, the training covers how to communicate face-to-face, on the phone, and also written communication both online and if you're going to provide hard copy information in writing. So do you think, you've mentioned that the retail industry are really interested in this initiative. Do you think that training will then help with, how they communicate with customers and enhance the work you've already done so far?
I mean, it is. I mean, obviously the whole communication, how this is communicated, to make sure the public are understanding of what this access symbol will mean. And if they then see that displayed in store, I think they will have a certain expectation that the staff within that store understand what it means and whether they need extra support or how to communicate. So I think they're well placed to kind of create that welcoming environment for anybody that would need it.
That's great, thank you. So I don't know if I can move on to Francis. So Francis, you're Director General of Public Relations in the Communications Association, and when we spoke, you talked about how your organisation represents the whole PR profession. And you also then talked to me about your own personal experiences of having communication difficulties. I just wondered if you wanted to share some of those and how this initiative you think is going to be very important for your industry.
Sure, thank you, Kamini. It's great to be involved in this. Let me talk about myself first and then the organisation second, if that works. So I've never publicly said this. So as a kid, I had a crushingly bad speech impediment. I absolutely hated speaking to anybody outside of my family, sometimes including my family, for that matter. And it ruined years of schooling because I would just be completely nervous the whole way through the school day about being called by a teacher to answer a question. And I don't just mean a little bit nervous, I mean sort of breakdown level of nervous, to the extent that for a whole year I didn't go to school at all. And my mother's attempts to sort out my problem were completely ineffectual, and she gave up in the end. And then at secondary school, some of the teachers were aware of this and would never ask me a question at any point ever, and some of them either weren't or didn't care and would. And I even now remember some of the occasions where I was asked a question and completely collapsed. And as Kate said, it was incredibly humiliating, and it felt as if I was in a mask permanently, so I just couldn't communicate with anybody. And it was only by forcing myself to do public speaking that I overcame it. But even now, when I'm tired, I can feel the lisp in my voice, and I'm constantly reminded of what it's like not to be able to communicate with people. So that's my personal interest in this, and that's why I'm personally very happy to be associated with it. Go to the corporate one, my members work across every industry in the UK and outside of the UK. Our logo says PRCA, the power of communication. And so we understand the power of it, and also how utterly lacking in power you are if you can't communicate. Our members are compelled by our code of conduct to act in the public good and the public interest. And their whole remit is to bring down barriers to communication. So that's why we're delighted to be part of this. And we will be, as the organisation that represents the industry in this country, we will be strongly encouraging all of our members to get involved in this, to adopt it, and where they are agencies, to make sure that their clients do the same as well. Because if we believe in the power of communication, then we believe it's important for everybody, and nobody should be excluded, particularly in these incredibly difficult times. So thank you for inviting us to be involved.
That's great. Thank you so much, Francis. And thank you so much for your passion and for your support. I think it's really clear that this is something that, as you said, you really can empathise with. So thanks so much for that. So I'm going to move on now to talk. Yeah. Sorry, Francis. Yeah.
No, I was saying, I really can empathise, and I know it's ironic that somebody who would never speak represents the PR industry. And you know, when I stand up in front of a room of 800 people, it reminds me of how important it is to be able to talk.
Yeah, no, absolutely. Thank you so much for that. So I'm going to turn to Craig next. So Craig Goold is head of the customer experience section of Skipton Building Society. So Craig, you're an early adopter of the Communication Access UK symbol and the training. So I just wondered if you could talk about your experience.
Yeah, we are an early adopter, but what we've seen is almost a natural extension of our work that we've been doing with Alzheimer's UK and Scotland. we're Dementia Friends, all of our branch network, 87 branches around the country, as well as our call centres. With over 90% of our colleagues all being Dementia Friends. We just see it as a natural extension of the work that we've been doing there. But within that, it's been a real eye-opener for the colleagues that we've been training within our trial branches. One of the things that it's enabled them to do is create a huge amount of confidence in interacting with people and recognizing and using the TALK acronym and really kind of listening to what people's needs are. And there's some really great examples where in one of the branches that we had that we're doing the trials in, there was a customer that had a stroke. And found it really difficult to communicate with our colleagues. And the way that she would normally come into the branch pre-doing the training was she'd either ask someone to write down before she came in so she could hand a slip to one of her colleagues, or she would point at how much money she'd like to withdraw from her account or put money in, or whatever the interaction was. But through using the TALK acronym and the training, which I'll go into a little bit more detail in a second, what they were able to kind of, with confidence, was that the customer was able to sing how much money she was wanting to withdraw or what her instructions were. So with that little bit of confidence, you know, kind of listening, taking time to understand what her needs were, now she has another way of communicating with us that she's really confident in doing. And we would never have discovered that without kind of working with and training our team. And there's numerous other examples as well. But fundamentally, I think it's about confidence in creating for our colleagues to be able to kind of talk and listen and identify what our customer needs are. We believe more than half of our customers have some sort of communication need or need some help. So this is going to be fantastic for our teams, and we're looking to roll it out over the rest of our branch network over the next 12 months. But part of the training were the speech therapists that helped us with the training, just so that our colleagues could empathise a little bit with our customers. Just ask them a simple question to describe what they had for dinner last night without speaking or writing. So simple things like that just enabled them to try to empathise more easily with customers that had, you know, really challenging communication needs. So that's kind of in the face-to-face environment. But we've also been looking at, obviously, everyone's moving to this more digital world with a kind of email communication. So we've reviewed all of our communications and made sure that we made them communication friendly. We've had more than doubled the number of customers that let us know that they have some communication needs through written communication as well by doing this, as well as all of our systems and app enhancements. We're doing accessibility testing as well. And again, we're discovering things such as our terms and conditions. So somebody that's using a screen reader, we listened to what it sounded like and instantly changed it. Fundamentally, it was I think 10 or 11 pages of terms and conditions that just kind of spoke the whole way through, and if someone had to pause, it would go back and start again. And there's other kind of challenges in there as well. So we've gone and changed our way that we break down our terms and conditions for people that have that use a screen reader. So there's lots of different advantages that we have. So I'm really proud to be an early adopter, but we're already starting to see some of the benefits for our customers, but also our colleagues, because we're adopting this as part of our, so we've got about 1,500 employees at Skipton around the country. And of course, our colleagues also have communication needs as well. So it's enhancing our customer experience, but it's also enabling us to have a better colleague experience as well.
That all sounds amazing, and I think, you know, the fact that you're actually identifying as you're going through the process of the fact that, you know, that there are things that need to be changed because they are really quite complex if you try and translate into other communication formats. So that's great that you're doing that, and I'm sure that you'll get really good feedback. So that was really interesting, Craig. I don't know if there was anything anyone wants to pick up on what Craig said, or if we should move on to Johnny then. Johnny, over to you. So Johnny Timpson, you're financial protection specialist at the Scottish Widows, but you're also working with the Cabinet Office as the disability champion for insurance and banking. So you have a particular interest in this initiative.
Yeah, Community and Nick, good morning, and thank you for inviting me to participate in this very important initiative. You can tell by my accent that I'm Scottish and I live in Scotland, and I have to say, I'd like to just put on record my appreciation of the work that the Royal College of Speech and Language Therapists have done in influencing the new Consumer Act, actually, in Scotland, in making sure that inclusive communication sits at the heart of that consumer legislation. And I think that's really important, because if I just talk about what we're doing within the Cabinet Office at the minute, in addition to my ambassadorial role in both banking and, well, actually in protection, and sorry, in insurance, which is my principal role, I'm actually obviously picking up the banking role as well, because they don't have a banking champion at this moment in time. But I'm also working on the development of the new National Disability Strategy with the Cabinet Office. And the work that this initiative is focused on really speaks to the themes of that developing new disability strategy, breaking down the barriers that prevent people accessing jobs, products and services, supporting people live independent lives, supporting people access a whole raft of products and services across all sectors of our economy. So I've made the Cabinet Office Disability Unit very aware of this piece of work and asked them to engage with you. And I've also reached out to, in terms of the insurance sector, it's a little bit of herding cats, because I'm dealing with 2 professional bodies and 13 trade bodies. I've engaged all of them, and equally banking's a little bit easier because they only have one body, which is UK Finance. So the good news is everyone's aware of this piece of work and everyone wants to get engaged. So that's a good starting point. But I think maybe just kind of go back a little bit, because my sector, both insurance and banking, is highly regulated. And pre-COVID, it was transitioning from a face-to-face model in the main to an online model. But there's still a big high street retail footprint, and that speaks to a lot of the issues that Tamara, Katie, and Ian raised. In actual fact, the very same issues about dealing with people in branch high street environments with masks on. How can we communicate with people effectively, and how can we recognise them? That they may have a visible or non-visible disability. So the lanyard scheme is helping there too. But but equally, if I take us back to the online environment, because what COVID has done is really accelerated that switch to digital online trading. Actually, quite interesting for people with disabilities. Isn't it amazing how all the barriers disabled people faced in accessing jobs, products and services, particularly jobs, it was too difficult, too expensive to make workplace adjustments. All of that's suddenly gone away, isn't it? So I think to some extent, there's, the new digital environment is empowering for people with disabilities, but we need to make sure that our online communication, our voice communication, is accessible and is inclusive, so it works for everybody. And picking up Ian's point about employees, because it's important that we think about colleagues too, and because obviously we want to encourage and support the number of disabled people in the world of work and help them with great careers. But the way that people enter the workplace now, the days of the face-to-face interview have gone. It's now been replaced by an online interview. The performance, the management, the coaching, mentoring that takes place is now online. So line managers now need to readjust their way of working, the way of thinking. I mean, I've met so many older managers, basically put great store on their ability to read people, to read body language. Well, that's a whole different issue when you're having to deal with people with visible and non-visible disabilities, and you're doing it online on phone, you're doing it by Zoom, or you're doing it by Teams. So there's a whole new skill set needs to be adopted there. But if I bring you back to some of the things that we are doing, I mean, I've established the Access to Insurance working group across my sectors, and that's basically focused very much. We started this work before COVID, because access was becoming an issue just because of the digital transition. So I wanted to make sure that we were improving access to products and services, that we're making people aware of their Equality Act obligations, that we were raising the importance of the social model of disability, and particularly the language and communication that supports that. Language and communication that respects disabled people as active citizens empowered to make their own decisions. Respecting, making sure that our language spoke to what they could do and identified the barriers that they were facing. We didn't use medical terminology that label people. These are important. So we have tried to encourage people to get engaged with disability confident, but that's just a badge and a scheme, isn't it? It's actually doing it, making a difference is important. So focusing on inclusive language, focusing on language that respects people, removing labels, accessible websites, accessible formats and fonts and font sizes, having alternative options like Braille or large print, voice loops, text to speech and speech to text, subtitles and translation services. These are all important. But the issue I see across the banking and the insurance land, there's lots of good things taking place. But what we do need to do is to set a standard. And thank you, because I think this work that you're doing establishes that standard, and the accreditation scheme gives us all a baseline to shoot for. But that's the baseline, because the challenge is, how do we build on it? So I think this isn't one and done. This is the start of an active, ongoing relationship. And I think that's what we need to embrace across all of our sectors. And certainly, be assured, I mean, the work, the opportunity I've got to influence within the Cabinet Office, I will be taking to land the importance of this initiative.
That's great, Johnny. Thank you so much. And you've really highlighted and brought to life the importance of quality of life for people. We all want to be able to go to the shops. We all want to be able to go to the pub or the restaurant. Obviously, pandemic restrictions are in place at the moment. But, how do we support people to live as normal a life as they can and respect them and show that we respect them, and we will adjust our communication to empower them to be able to access things I think we all take for granted and have done. It's great that everybody's really on board, I think, to see how we can work together. And I think it is about, as Ian was saying earlier, about the pandemic is bringing people together and how we create a sense of community and to support some of the most vulnerable who might feel even more excluded at the moment. But I don't know if anybody's got any other comments to make on what you've heard from colleagues or panel members. Nick, did you have any reflections, or anyone else?
I would also just like to say that we have here a group of people that represent hospitality, the communications industry, retail, finance, manufacturing. And if we sort of put all those together as a sort of a view of this country, then you're pretty much, or between you, reaching every aspect of this country. And I'd like to think you will go forth, as it were, and spread the word and actually enthuse everybody that you deal with in your own sectors about the project that Kamini has kicked off, so that before long it will really become part of the fabric of this country. And Kate, I hope that our symbol will join the other symbols like Drink Aware and all the rest of it on every doorway to every hospitality outlet, if I can use that dreadful word, and will take its rightful place there as an important part of what we're all seeking to achieve, to help people with those difficulties, but also, in a sense, to help every industry in the country to improve other people's situation. So that would be my sort of take on the conversation so far. And I guess we could say that together you sort of embrace the whole of society, all those areas. I ran through them before: hospitality, comms, finance, and all the rest of it. And so I'm not suggesting that you're disciples, but I'd like to think that you could be sort of sent out, not only to spread the word, but to implement the word amongst your own communities. And if that's done with enthusiasm and belief and vigor, then this initiative will really catch fire and will become an important part of Britain's society, really. And it's that would be a wonderful achievement. That's what I'd say.
It really would. It's a really important moment for us, I think, and very, very important to hear how we might go forward, as you said, Nick, both for colleagues to go forward, but also how we can work together. Because I think what I'm picking up from Johnny is there is an opportunity to see how we might work together to share some of those examples of working and coming up with creative solutions, which I think you've all talked about at length, which is fantastic. So thank you. I don't know if there's anything else anyone wants to add, but I'm just so impressed and quite blown away actually by all of this. This is, I think for somebody, who's been in the profession for many decades now, and we've been talking about this initiative for a few years, to hear your commitment is incredible, really is, and we're so grateful. It's brilliant. Thank you.